Well, welcome everybody to our online program on addiction recovery from the Sunshine Coast Health Center up here in Powell River, BC. And this one's sort of a grab bag. One of the things that I'm always fascinated with is, in spite of all the research that we've done in the field over the last 40 or 50 years, and all these different views that we've been exposed to, and some of them have been proven to be like this whole moral model that it's people with addictions are irresponsible layabouts. All that's been more than proven to be false. Still, to this day, it creeps into the public realm, these old ideas, which is really quite fascinating, because I begin to think about, well, how could this be? We have so much research, so much scientific evidence. How can these old ideas simply exist? Anyway, I thought I'd throw out a few of them in on our online program. And one of these things that fascinates me is the whole medical model. Now, we've talked before on the online program that there are many theories of addiction. The psychologist James West actually outlines 24 distinct theories of addiction, and he makes this comment that although there are 24 different theories, they're all conflicting. They're all different, and some of them seem to explain some parts of the addiction, and others seem to explain other parts. But no one's bothered actually to put them together. And he makes this comment that they're all working diligently on their theory, but they don't really confront any evidence that's contrary to what they believe. And in this medical model, this is really quite fascinating, because this gets a lot of publicity and a lot of funding. And it seems to have sort of risen to the top of the poll there. And one of the things about the medical model that several researchers have pointed out, that isn't it curious that in spite of all of the promotion on the medical model that it's addiction's a brain disease, or at least a problem in the brain, it really hasn't convinced many people. Journalists have written about it, they've been advisors to politicians, and yet we just don't really believe it. And it's a really curious thing. So this researcher was actually trying to figure out why was this? And what he suggested was that the first thing, if you use the medical model, is that you really are quite limited in what you can do to help somebody. I mean, basically, you sort of got to admit that really what we really need is abstinence. And so maybe we can give you some medications, to help you with the craving. Or for some of you who are aware of it, we've talked about this on the online program before, a vaccine. They've actually developed these things, by the way. Or really, maybe at a real stretch, we'll give them some relapse prevention skills, give them some new coping skills so that they can be abstinent. But other than that, really, there's nothing you can do if it's actually a brain disease. So this, according to this researcher, this is one of the big knocks on the whole medical model, is that you're so limited on how to help people. And the other one is outcome studies from these medical treatments that, frankly, aren't really any better than any other treatment. So it's not like we're finding, oh wow, this is the answer. Look at 75% success rate, people over a year are keeping away from the drug. No, we don't see that at all, right? And so, in spite of the fact that we keep promoting this, there isn't a lot of evidence that it's really working at a level that we all hope it works at. Anyway, that was his. And another possibility he never mentioned, that one of the great things about the medical model is it's a neat, tidy package, right? And it gives the authority of science that we can explain everything through it, right? But it's curious, it doesn't really have that explanatory power, as we've talked on the online program before, because it actually doesn't directly confront evidence that conflicts with it. Anyway, it's one of those curious things in the field that a handful of researchers have pointed out, that in spite of all of the publicity and all of the funding, why doesn't the medical model actually convince a lot of people? Anyway, that's it for this episode, and we'll be back next time with another topic.